Welcome back to the Deep Dive.
Great to be here.
Today, we're plunging into a challenge that can strike real fear into any horse owner. Equine gastric impaction.
Yeah, it's definitely something owners worry about, even if it's relatively rare.
Absolutely. So our mission today is
Mhm.
to cut through the complexity of the research papers and expert guides you've shared with us. We want to pull back the curtain on this often misunderstood condition.
Get to the core of it.
We'll go from the subtle early signs, the ones you might miss, right through to the life-saving interventions.
And critically, prevention. How to hopefully avoid it altogether.
Exactly. It's a fascinating look into the unique mechanics of the equine digestive system and, well, the surprising factors that can throw it off course.
It really highlights how sensitive that system can be.
All right, let's unpack this then. When we talk about equine gastric impaction, what are we actually defining here? What's the core of the problem?
Okay, so essentially it's when a horse's stomach gets distended, stretched out because of this buildup of dehydrated feed material. The ingesta.
Ingesta, right, the digested food.
Exactly. And the key thing is it just won't clear. It gets stuck. Think of it like a stubborn, firm mass just lodged inside the stomach.
Okay, that sounds pretty serious.
It is, and it's important to clarify something here. You might hear the term gastric dilation.
Yeah.
Well, impaction causes dilation, the stretching, but gastric dilation often refers more to that acute, really painful buildup of fluid and gas, usually from something like a small intestinal blockage.
So a different immediate cause, even if the stomach is stretched in both cases.
Precisely. Gastric impaction usually has a more insidious onset. It creeps up more slowly, subtly. Though don't get me wrong, it can absolutely become acutely severe if it's not dealt with.
I can see how that distinction is crucial for diagnosis.
So thinking about the horse's anatomy itself, is there something unique about their digestive system? Something that makes them particularly susceptible to these kinds of blockages?
Absolutely, that's a key part of the puzzle.
Yeah.
The horse has what we call a monogastric system.
Meaning one stomach, unlike cows. Right. And it's designed for continuous small meals throughout the day, grazing, not big, infrequent feeds like we might eat.
Okay.
And a really critical anatomical feature is the cardiac sphincter. That's the valve at the entrance to the stomach.
Right.
It's incredibly strong in horses, like a one-way street.
Which is why they can't vomit.
Exactly. What goes down, stays down. Or, well, it's supposed to keep moving down. That inability to relieve pressure upwards is a major factor in why stomach issues get so dangerous so quickly.
Makes sense. What about the other end?
Good point. At the other end, where the stomach empties into the small intestine, the duodenum, there's another critical valve, the pyloric sphincter.
The exit gate.
Kind of, yeah. Think of it like a gatekeeper controlling the release of partially digested food. And it's often right at this gate, the pylorus, or sometimes in the main body of the stomach itself, that these impactions get stubbornly lodged.
So how does it actually form, the impaction itself?
Well, it's usually a combination of things. You've got problematic feed material, maybe too coarse, or something that swells up.
Then, maybe inadequate chewing, often linked to dental problems.
Right.
And critically, not enough hydration, not enough water.
Right. Dehydration.
These things combine with impaired gastric motility. The stomach isn't contracting and emptying properly, and it all leads to this firm mass forming. It's just too large or too solid to pass through that pyloric sphincter.
And that causes the pressure and distension.
Exactly. Leads to pressure, stretching, pain. One key difference from some other acute gastric issues, though, is that the gas buildup with an impaction is usually slower. It's more about the solid mass causing the problem initially.
It sounds like a complex problem once it's established. Let's dig into the why a bit more deeply. What are the specific factors that set a horse up for this condition in the first place? What are those key risk factors we need to know about?
That's a great question. And while it's true it's multifactorial, the really interesting insight here, I think, is how deeply it ties back to the fundamentals of daily horse care.
Well, it's about what they eat, how they eat it, and their hydration, things we manage every day. Often it's a combination of seemingly minor daily management decisions that can accumulate, setting the stage for a major problem like this.
So it's not always one big dramatic event.
Often not. Let's break it down. Feed-related factors are a big category. We often see horses ingesting highly fibrous, coarse feeds. Think poor quality hay, really stemmy hay.
The stuff they might leave behind usually.
Sometimes, yeah, or even straw if it's being eaten as bedding instead of just slept on.
Okay.
On the flip side, finely ground or pelletized feeds can be an issue too, particularly certain types of beet pulp.
Really? I thought beet pulp was good for digestion.
It can be, but the key is it must be adequately soaked. If they eat it dry or not soaked enough, especially if they eat it fast, it swells up significantly inside the stomach. Needs lots of water.
That makes sense.
Rapid changes in diet can also be a culprit. The gut needs time to adjust. And while things like sand or, bits of plastic or baling twine usually cause problems further down in the intestines, they
Right.
can sometimes contribute to stomach issues too. And just plain overeating, especially of those dry, expensive feeds, is another risk.
Got it. Any specific examples that stand out from the sources?
Yes, actually a really fascinating one. Persimmon seeds.
Persimmons, the fruit.
Exactly. The seeds contain a natural chemical, a type of tannin. It's water-soluble. When it mixes with the horse's stomach acid, it basically polymerizes. It turns into this sticky, almost glue-like substance.
Oh.
Yeah, they call it an adhesive coagulum. This sticky stuff then binds with the plant fibers from the fruit or whatever else is in the stomach, and it creates this incredibly hard, solid mass, like a rock.
That sounds nasty. When would they encounter persimmons?
It's more likely in the fall when the fruit is ripe and might fall from trees and pastures. Mesquite beans are also mentioned sometimes as a potential cause of similar issues.
Okay, so feed is a big one. What about management, more broadly?
Huge. Inadequate water intake is absolutely massive.
Just not drinking enough.
Right. Whether it's limited access or the water is frozen in winter, maybe it tastes bad, or the horse just isn't drinking enough because they're sick or stressed from transport, or even just because it's really cold.
Yeah, you hear about that in winter.
Definitely. And then poor dental care. This leads to improper chewing, not grinding the feed down enough. That's a massive factor.
So those regular dental checks are really important then.
Crucial. We'll come back to that in prevention. Also, horses that eat too quickly, the ones that bolt their feed,
The greedy ones.
especially if they're competing with other horses for food, that increases risk. Lack of exercise or confinement, that can reduce overall GI motility. The gut just gets a bit sluggish.
That makes sense.
And even stress. Psychological stress can impact gut function.
Wow, okay, so feed, water, teeth, eating habits, exercise, stress.
What about factors related to the horse itself? Intrinsic factors.
Mm.
Good question. Poor dentition, as we mentioned, is noted as the most common intrinsic factor, especially in older horses whose teeth might be worn down, missing, or painful.
So older horses are higher risk.
Generally, yes, because of teeth. But foals can sometimes be affected too, for different reasons.
Yeah.
Also, chronic illness or just being generally debilitated. If a horse is unwell, dehydrated, or in pain, that can reduce GI motility and water intake, creating a cycle.
Right.
Certain medications can also play a role. Things like anticholinergics, atropine is an example, or even opioids used for pain relief. They are known to slow down the gut.
Okay.
Severe ulcers near the pylorus, that exit valve, if they cause inflammation or scarring, can actually narrow the opening.
Physically blocking the exit.
Effectively, yes, that makes it harder for things to pass. And interestingly, liver disease, particularly the kind caused by ragwort poisoning, has also been described as a cause in some cases.
That's surprising. Liver disease affecting the stomach.
The links aren't always direct, but systemic health impacts gut function. Then, in really rare cases, you might have a primary gastric motility disorder. The stomach muscles just don't work right, or even a gastric mass like a tumor or a polyp, physically blocking things.
And parasites, worms.
Theoretically, yes. Large burdens of specific stomach worms, like Gastrophilus larvae or bots, could potentially contribute, though it's probably less common than the feed and dental issues.
All right, so a lot of potential contributing factors there. Now, if I'm out in the barn, maybe I'm worried. What are those critical early warnings? What are the signs every horse owner needs to be vigilant for? What might tell me something serious is brewing?
Right, because catching it early makes a huge difference. The signs can really range, and often they do start subtly.
Like what?
You might just see mild intermittent colic, maybe the horse is stretching out or looking at their flank, a bit of pawing now and then. And these signs can come and go, wax and wane.
So not necessarily dramatic rolling colic.
Not always, especially initially. In more acute cases, sure, you might see increased heart and breathing rates, tachycardia, tachypnea, but those are often absent in the more chronic, slow onset situations.
Okay, what else?
Anorexia or just partial anorexia.
Mhm.
A reluctance to eat, that's a pretty predominant sign, often goes along with weight loss over time if it's chronic.
Do they stop drinking too?
They might drink initially, but then often refuse water as well, especially as the stomach gets fuller and more uncomfortable.
And but manure.
Yeah, you'll likely notice reduced or even absent fecal output. Or maybe the fecal balls are small and dry, signs that things aren't moving through properly.
Lethargy.
Definitely, especially in chronic cases. The horse just seems dull, depressed, not themselves.
Any other visible signs?
Sometimes, if there's gastric reflux happening, fluid backing up, you might see nasal discharge. It might be feed-tinged saliva. It's usually less profuse, less dramatic than the reflux you see with an acute small intestinal obstruction, but it can happen. And on examination, a vet would typically find decreased gut sounds, borborygmi, and often a decreased body condition score if it's been going on a while, plus signs of dehydration.
And the worst case scenario?
In severe, prolonged cases, it can unfortunately progress to severe, intractable colic or even gastric rupture, which is an absolute emergency, often fatal.
So the signs can be quite subtle, almost mimicking other types of colic or illness. That must make it incredibly challenging for a vet to pinpoint gastric impaction specifically, especially since the stomach is tucked away up front.
It absolutely does require a skilled approach, and
Yeah.
you're spot on about the challenge. Diagnosis isn't always straightforward just from the initial signs.
So what's the process? How do they confirm it? Is there a gold standard diagnostic test?
There is. But first, a thorough history is crucial. The vet needs all that background info. Diet, water intake, dental history, age, the pattern of the colic signs.
Right, all clues.
Exactly. Then a careful physical examination to assess the horse's pain level, heart rate, breathing, hydration status, gut sounds. But the single most essential diagnostic and therapeutic tool, the one that really gives the answer and starts the treatment, is nasogastric tube passage and stomach lavage.
Passing the tube. That sounds unpleasant.
It's not fun for the horse, which is why sedation is important, but it's often life-saving. It's really the gold standard here, key for both confirming and treating the impaction.
How does it confirm the diagnosis?
Well, the technique involves passing a large bore flexible tube up the horse's nostril, down the esophagus, and into the stomach. Now, key finding often is that you don't get that spontaneous, copious reflux, that gush of fluid that you often see with small intestinal obstructions.
Because the blockage is in the stomach, not further down.
Exactly. The fluid isn't backing up from the intestine in the same way. The tube itself might even meet resistance as it enters the stomach, hitting that solid mass.
Okay, so no reflux is a clue. How do they confirm it's an impaction?
This is where the lavage part comes in. The vet will carefully infuse, say, 5 to 10 liters of warm water or maybe a dilute electrolyte solution into the stomach through the tube.
Pump water in.
Gently, yes.
Oh.
And then they lower the end of the tube and siphon it back out. The diagnostic confirmation comes when that siphoned fluid returns mixed with large amounts of feed material. That tells you there's a significant amount of undigested stuff stuck in there.
Okay. Washing out the evidence, essentially.
You got it. Are there other diagnostic tools they might use?
Yes. Other procedures can definitely assist. Abdominal ultrasonography, for example. Ultrasound, can they see the stomach?
They can. It takes skill because of the location, but they can visualize a distended stomach. And importantly, they can assess the stomach wall. Normally it's quite thin, maybe 1 to 5 millimeters.
Right.
With a chronic impaction, the wall can become significantly thickened, maybe over 10 millimeters, even up to 35 millimeters in some reported cases. That thickening is a strong indicator of chronic distension and inflammation from the impaction.
Yeah.
It also helps differentiate it from small intestinal issues.
What about rectal palpation?
Usually, the stomach is too far forward to feel directly on a rectal exam. However, in chronic cases with severe dilation, the enlarged stomach might be palpable, or sometimes you can feel that the spleen has been displaced by the enlarged stomach, so it can provide clues.
And gastroscopy. Putting a camera down.
That's often difficult initially because the feed material just blocks the view. But if the horse has been fasted for a good while, say at least 16 hours, sometimes you can actually visualize the surface of the impaction. If it's caused by persimmons, you might even see the seeds embedded in it.
Wow. Okay. And surgery.
Laparoscopy, which is keyhole surgery, or a full exploratory laparotomy opening the abdomen, are really the only ways to get a definitive, direct look. But these are much more invasive and usually reserved for cases where other methods aren't conclusive or if surgery is being considered as a treatment.
Okay. So nasogastric intubation and lavage is really the key step.
Absolutely. Diagnostic and therapeutic.
So Once a vet confirms this diagnosis via the tube and lavage, what's the immediate course of action? What does treatment involve to get that horse on the road to recovery?
Right. So you've confirmed it. You've maybe even started removing some material with that initial lavage. The entire treatment strategy really focuses on a few key things: breaking down and removing the rest of that impaction, providing crucial supportive care to the horse, and vitally trying to prevent it from happening again.
Makes sense. So more lavage.
Yes, the absolute cornerstone of treatment is repeated and persistent gastric lavage. This truly is the most effective therapy we have for this.
To keep flushing.
Pretty much, but carefully. The technique involves sedating the horse first, using drugs like xylazine or ditomidine. That's essential for their comfort, for muscle relaxation, and just to make the whole procedure safer for everyone.
Okay.
Then you slowly, carefully infuse maybe 5 to 10 liters of warm water into the stomach via the tube, let it sit for a moment perhaps, and then siphon it back out.
And you just keep doing that.
You repeat that process over and over again until you start getting clear fluid back. That indicates the impaction has resolved or at least significantly reduced. It can take many, many cycles. We're talking potentially 50, even 100 liters of water or more administered over several hours.
Wow, that takes serious dedication.
It really does. And there's a crucial caution. You have to avoid excessive pressure when infusing the fluid. The stomach wall can be compromised, and gastric rupture is a real risk, even with correct fluid therapy.
So gentle and persistent.
Exactly. Start conservatively, maybe just 1 to 2 liters at a time, especially initially. Assess the return and gradually increase as seems safe.
Okay, lavage is key. What about other supportive care?
Crucial. Intravenous fluid therapy, IV fluids, is absolutely essential.
For hydration.
Yes, primarily to correct the dehydration that's almost always present, but also to support circulation, organ perfusion, and the IV fluids actually help to hydrate and soften the impaction from the inside out, so to speak. Often, aggressive fluid rates are needed using balanced solutions like lactated ringers.
Pain relief too, I assume.
Definitely. Pain control is important for the horse's welfare and can help with motility, too. NSAIDs, non-steroidal anti-inflammatory drugs like Flunix and Miglumin are typically used.
You mentioned motility earlier. Are there drugs to help get the stomach moving again?
Yes, we call them prokinetics, or motility modifiers. These are drugs that basically aim to stimulate the gut, including the stomach, to contract more effectively.
Give a push.
Sort of. Drugs like lidocaine can be given as an IV constant rate infusion, a slow, steady drip. Metoclopramide is another one, sometimes given as a CRI or injections. Erythromycin, an antibiotic, actually has prokinetic effects at certain doses, too.
So you use those right away.
Well, there's a bit of a catch. They're generally considered most effective after the impaction has started to break down through lavage. If the stomach is still completely blocked by a solid mass, the prokinetics might not be able to do much until that physical obstruction is reduced. So, lavage first, then consider prokinetics.
Okay. What about things given down the tube besides water, like laxatives?
Yes, lubricants or laxatives can be used. Mineral oil is common, maybe 1 to 5 liters given via the tube every 4 to 6 hours. Magnesium sulfate, which is Epsom salts, can also be used as an osmotic laxative, drawing water into the gut.
I think I read something about cola, like Coca-Cola.
Yes, that has been reported anecdotally, particularly for persimmon impactions. The idea is the acidity and carbonation might help break down the mass. The evidence is pretty limited, though, and its actual effectiveness is questionable compared to persistent water lavage.
Right.
And a key caution with giving anything oral, whether it's mineral oil, laxatives, or cola, is you have to be careful not to add too much volume if the stomach is already severely distended and not emptying. You risk making the distension worse or even causing rupture. Lavage to remove volume first is safer.
Okay, and food.
Absolutely restricted.
Yeah.
The horse is fasted no feed at all until the impaction is resolved. Then feed is reintroduced very, very gradually. Start just with water access, then maybe some sloppy soaked mashes, slowly building back out to hay.
What about surgery? You mentioned it earlier for diagnosis. Is it ever a treatment?
It's considered a very rare last resort, only really an option for these intractable impactions that just aren't responding after, say, 24 to 48 hours of really aggressive medical management with lavage and fluids. Or if gastric rupture is suspected, though the prognosis then is dire.
What does the surgery involve?
It involves a gastrotomy surgically cutting into the stomach to manually remove the impacted material. But it's a high-risk procedure in horses. The stomach doesn't heal as well as intestine, the risk of contamination in the abdomen is high, and the prognosis is generally guarded to poor. Medical management is strongly preferred.
Okay, so medical management, especially lavage, is the mainstay. Now, thinking about outcomes, what are the potential downsides or worst-case scenarios a horse owner might face, and what does the future generally look like for a horse that's had this?
Right, the potential complications are serious. The most feared one, by far, is gastric rupture.
Which you said is often fatal.
Almost inevitably, yes. It leads to massive contamination of the abdominal cavity, peritonitis, and septic shock. It's catastrophic.
Are there other risks during treatment?
Yes. With repeated nasogastric intubation, there's always a risk, though small, with careful technique, of complications like aspiration pneumonia, inhaling reflux material into the lungs, or causing irritation or even strictures in the esophagus, esophagitis.
And can it happen again? Recurrence.
Yes, recurrence is definitely possible, especially if the underlying predisposing factors like poor teeth or poor water intake or the type of feed aren't identified and managed effectively after the horse recovers.
So what's the general prognosis then, if it's caught and treated?
Generally, it's considered good to excellent if the condition is diagnosed early and treated aggressively and successfully with that repeated gastric lavage and supportive care.
That's encouraging.
It is. However, the prognosis becomes much more guarded, even poor, if the impaction has been present for a long time, if it causes severe damage to the gastric wall, or, tragically, if rupture occurs.
Is there a time frame? Like, how long do you try medical treatment?
There's a general consensus in the literature that if a gastric impaction doesn't show signs of resolving within about 5 days of intensive medical treatment, it's unfortunately unlikely to succeed medically.
And what about cases with that severe dilation you mentioned?
Right. Once severe chronic dilation of the stomach has occurred, that thickened wall we talked about seeing on ultrasound, the success of any treatment, whether it's medical or surgical, becomes much less likely. And even if you do manage to resolve the initial impaction, recurrence is highly probable because the stomach may have lost its normal tone and ability to empty properly.
That really underscores the importance of early intervention.
Absolutely critical.
Which brings us to perhaps the most important point. Given how challenging treatment can be in severe cases, how can we prevent this from happening in the first place? And you mentioned poor dental care earlier, calling it a massive factor. So does that mean routine floating is literally a life-saving preventative measure for this specific condition?
Prevention is truly paramount here. And yes, you absolutely hit the nail on the head. The most important single preventative measure is excellent dental care.
Really? That fundamental?
Without a doubt. Regular dental examinations and floating, smoothing off the sharp points and correcting any imbalances ensures the horse can chew their food efficiently, grinding it down properly. That is the very first step in digestion, and if it's compromised, the risk of impaction, both gastric and intestinal, goes way up. So yes, regular, good quality dental care, ideally annually or maybe even biannually for older horses with known issues, can absolutely be life-saving for preventing this condition.
Okay, number one, teeth. What else?
Number two, arguably just as critical, adequate water intake.
We keep coming back to water.
Because it's essential. Constant access to fresh, clean, palatable water is non-negotiable, and you need to actively monitor their consumption, especially during weather changes, extreme cold or heat, or during travel or illness. Hydration is crucial for keeping ingesta soft and moving.
Any tricks to encourage drinking?
Making sure tanks are clean, water isn't frozen, offering warmed water in winter can help some horses. Adding electrolytes or a bit of apple juice can tempt picky drinkers sometimes. And soaking hay is another great way to increase water intake, especially for horses prone to issues.
Good tips. What about feed management itself?
Also vital. We mentioned soaking beet pulp or other pelleted feeds. Always do that thoroughly, according to the manufacturer's instructions. Avoid sudden, drastic diet changes. Introduce new feeds gradually over a week or two.
Slow feeders.
Excellent idea for horses that bolt their feed. They force the horse to eat more slowly, chew more thoroughly, produce more saliva. Avoid feeding really coarse, stemmy, low-quality hay if possible. And if you use straw for bedding, try to minimize consumption, maybe by providing plenty of good hay or using a different bedding type if they're really eating a lot of it.
Okay, and exercise.
Regular exercise, even just turnout time, helps promote normal GI motility, keeps things moving. Stalled horses with limited movement are generally at higher risk for various types of colic, including impactions.
And finally,
managing any underlying health issues. If a horse has a chronic illness that might affect their appetite, hydration, or gut motility, working closely with your vet to manage that condition is also part of prevention.
so it really is about consistent, high-quality basic care.
Fundamentally, yes. Teeth, Water, appropriate feed, exercise, and general health monitoring.
So wrapping this up, what does this all mean for you, our listener? We've learned that equine gastric impaction, while relatively rare, is a serious condition. Timely diagnosis, recognizing those often subtle early signs, and aggressive treatment, primarily involving that persistent gastric lavage, are absolutely critical for a positive outcome.
Early action is key.
And understanding the multiple risk factors, especially as we've emphasized, the profound importance of excellent dental health and consistent adequate water intake is really the foundation of preventing this difficult condition in the first place.
Absolutely. Prevention through good husbandry is far better than cure here.
Definitely. So maybe a final thought to leave our listeners with.
Well, if we connect this to the bigger picture, we've seen how interconnected basic things like dental health, hydration, and diet are to preventing such a severe internal issue like gastric impaction. So maybe the provocative thought is this. What might this tell us about the subtle, cumulative impacts of all those daily management decisions, the ones that seem small day to day on an animal's overall well-being, even far beyond just the stomach? How much did those little things really add up over time?
That's a great thought to chew on. Thank you so much for sharing your expertise today.
My pleasure.
And thank you, our listeners, for joining us on this deep dive into equine gastric impaction. Keep learning, keep exploring, and we'll see you next time.